this video, we show the stimulated single-fiber EMG of the orbicularis oculi, a test that is done regularly in cases suspected of ocular myasthenia gravis or generalized myasthenia gravis or other neuromuscular junction disorders. For this stimulated single-fiber EMG, we use two monopolar needles. One is the reference put behind the ear. The other one is the stimulating monopolar needle, and this we put in a small hole that you can feel in your os zygomaticum in front of the ear. Over there we put the needle, a very short needle of 1.5 centimeters. So over these two needles we create a certain potential, and this potential will stimulate the muscle fibers of the orbicularis oculi. Whenever we got this kind of blink response due to stimulation, we will insert a concentric needle, the shortest one. We use 2.5 centimeters. We will insert this needle in the orbicularis oculi and try to detect fiber pairs. In fact, in stimulated single-fiber EMG, it is a pair constituted of our trigger, of the stimulation trigger, and one muscle fiber. So this is not a pair of two muscle fibers that we are recording. As you see on the screen on top, we will get our stimulation artifact as well as the muscle activity. But very important is that as we use a concentric needle and not a single-fiber EMG needle, is that we adjust the filter settings. The high-pass filter should be elevated to at least 1 kilohertz using this concentric needle. So let's try. Put the sound on, and with the pedals I will start the stimulation. I look for blinking of the eye, and I see the blinking. You see the eye is moving while the patient is dreaming in the far, so he is not contracting the muscle. This is the stimulation artifact that we are creating. I'll put the needle in the orbicularis oculi, and we see in the beginning of the screen our stimulation artifact. To the stimulation artifact, I'm looking to individual muscle fibers. You know, we need muscle fiber activity of 300 microvolt, which means with a gain of 150 microvolt per division, I need to find muscle fibers of 2 divisions. So let us try to get stable muscle fibers, stable activity of muscle fibers of at least 200 to 300 microvolts. This is by turning the needle and by adjusting the position of the concentric needle in the muscle. Whenever I see a stable pair, I will press with my pedal. I will start the recording. At least 100 recordings. Now I go to next insertion, and we will repeat the same procedure. Now in the beginning we have 2 stable fibers, which I will record. I will go to my next insertion and start again the stimulation. I turn the needle 90 degrees to find other pairs. So it's not only turning the angle of the needle, it's also about turning the needle itself around its axis. Very beautiful pairs here. I will go to next insertion, start the stimulation, and start the recording. 100 recordings. I will go to next insertion, start stimulation, turn the needle a little bit so that I have other muscle fibers in my scope. I hear the sound is slightly different because it's fibers from other direction. And I start recording. So let us analyze some of our recordings. Meanwhile, we can leave the needle because at least we need more pairs, or we can just ask the patient to relax a little bit and taking the needle out. But of course, then we need to insert the needle again. This depends on the examiner and on the comfort for the patient. Let's look at our response. This is a clear pair of a stimulating artifact and one muscle fiber. So we want now to evaluate, to calculate the jitter between this stimulated artifact and this first muscle fiber. In order to do that, we have to find the two cursors. The first cursor is automatically placed by the computer on this stimulation artifact. The second one is the blue one, which we place on our first muscle fiber that we see. This is a very reliable answer as the peak is sharp, has a high amplitude. The sensitivity is 150 microvolt per division. I can decrease the sensitivity a little bit so that we get the answer completely in the screen. So it's a very high answer. The jitter is 19. So again, the jitter is the average of the summated, of the sorted or the consecutive inter-peak interval differences. This calculation is done by the software. Now in the same measurement we have another pair, so I can do next pair and put the yellow cursor on this second pair. I see that the jitter is 34 for this pair. For individual recordings, depending on the needle, depending on the filter settings, we need the right reference values, but for individual jitter pairs, sometimes this can be still a normal value in stimulated single-fiber EMG. If we go to this number, number 4, again we see some beautiful pairs. We put the cursor on the first pair. We see that a couple of them have been blocked, although we have nice answers that are recorded. But 84% are blocked. Let's check. I see indeed that this muscle fiber is not correctly responding to all my stimulations. And this not responding is not because the muscle fiber is blocked, but it's just because the stimulation probably is too low to this muscle fiber. I will not consider it as a block or as an abnormal pair. I expect, of course, if abnormal pair, the jitter to be very high. The jitter is high, but does not explain 84% of the recordings that is blocked. So this pair I will just erase. But we have some other pairs over here. We just move the blue cursor. Okay, and now we have a jitter value which is 22, and this one is perfectly acceptable. Next pair is the yellow cursor, so the color is indicated by the computer, and over here it's 30.5, it's perfect. And this is how we continue our different pair measurements and our different jitter measurements. But remember, in evolutional single-fiber EMG, a pair is constituted of a trigger, of a stimulation trigger, and one muscle fiber.